This podcast has been sponsored by QOL Medical and Shar. Maintaining a healthy gut is key for overall physical and mental well-being. Whether you're a health-conscious advocate, an individual navigating the complexities of living with GI issues, or a healthcare provider, you are in the right place. The Gut Health Podcast will empower you with the fascinating scientific connection between your brain, food, and the gut. Come join us. We welcome you. Hello, friends, and welcome to the Gut Health Podcast, where we talk about all things related to the gut and well-being. We are your hosts. I'm Kate Scarlata, a GI dietitian.
And I am Dr. Megan Riehl. And we are so excited to be recording this podcast and be starting this podcast. And we're going to be zooming out and talking about why gut health matters. We feel like it's necessary to have a safe space to unravel myths and bring tangible, everyday tips to our listeners. And Kate and I are so excited to have these conversations about such an important matter that really impacts all of us. So, Kate, why does gut health matter to you?
Well, I'm so glad you asked, Megan. You know, when I think about overall gut health, I think it's just amazing that these little microbes that we really didn't pay attention to, until recently, that they play such a crucial role in maintaining our overall health and really preventing a variety of diseases. And I think learning that these microbes can get imbalanced and how that is associated with things like heart disease, that is a number one killer in America, and cancer. And then all these neurological conditions like Alzheimer's and Parkinson's disease. And of course, you and I being in GI, we definitely are learning the connection between these alterations in our gut microbes associated with irritable bowel syndrome, gastroesophageal reflux disease, and inflammatory bowel disease. It's very interesting. I have to say, we can't jump the gun because this is really new. It's not like we really know what we're doing here. We're just tapping into the science really relatively, in the last probably 20, 25 years. But what do you think, Megan? What gets you going?
Well, I think we're lucky, right? Because on our show, we're going to be bringing some of the scientists and leading experts in this area that is still, like you said, it's new in medical terms is in the last decades and 20, 25 years. So what we know, even in terms of how intricate our brain-gut connection is. And there's so much interest in how our body is impacted by our environment, which, trickles down to affect the inner workings of our body. So as a psychologist, and we'll talk a little bit more about each of our history and our areas of expertise, but from a psychology perspective, the fact that these microbes can impact our mood and the regulation of different neurotransmitters in our body. One that comes to mind is dopamine, right? So when we think about dopamine, it's a feel-good neurotransmitter. And the microbes can be this precursor to also serotonin. Serotonin is another one of those feel-good neurotransmitters that can induce calm. And when we think about calm, we think about kind of the emotional state of calm, but these aspects of chemicals within our body also produce calm in our gut and our system. So I think that as a psychologist and the work that you do as a dietitian, the reality is we need all of us to help people achieve gut health. And we're certainly going to dive into that in this podcast series, this reality that approaching gut health is important for everyone. And a lot of the tools that we provide to our patients every day, one of the reasons we came up with doing this podcast is because 45 million Americans are affected by a bowel disorder, IBS. And why don't we help everybody? Why don't we start to broaden the conversation to people that might not have IBS, but are curious about their overall health?
It is remarkable. I mean, I think it makes sense that if there's alterations in our gut microbes, that would affect a GI disorder. But to me, seeing, heart disease and all these other areas being affected is really exciting, because maybe we will really develop some new therapeutics to really reduce risk of all these chronic diseases that many people are suffering with. From a dietitian perspective, I think, it is interesting, because what we eat, we are what we eat. Well, we are what we eat for us, I guess. But then what about those trillions of microbes that are living in our gut that help regulate our immune system and help create vitamins for our body and keep us from some of these chronic diseases? We're feeding them too. So what we're eating, we're feeding them. And basically it comes down to what we eat, what escapes digestion by the human body ends up in the colon. And that's where the bulk of these microbes are residing. And they're waiting there like, what's for dinner? And, it might be a lovely salad, residual fiber from salad, or a beautiful smoothie that your body couldn't process all of the fiber. And then we're fueling them to do good things. So what we feed our gut microbes matters. And we're learning that more and more, that diet plays a big role in keeping the good guys going and minimizing some, what we often call as potentially pathogenic microbes. We all have some of those potentially pathogenic microbes in our gut, but it's about keeping the good guys in charge. And so there's not a lot of bullies in there, basically. And so the role of diet here does really play a role in fueling those health promoting microbes.
So what we eat matters, clearly, but it's not an end all be all. And I think sometimes we can get fixated on trying to control things. I can control what I put into my mouth if you have that luxury, right? We know that food and food choices are a privilege, but if we have some control over what we put into our body, and yet maybe we're still not functioning as well as we want, we have to zoom out a little further and recognize that our mood can impact how we feel physically, and our mood can be impacted by a variety of things, our environment, our physical activity level. And so when I'm working with my patients, I really like to remind everyone that we all have our own individual fingerprint of what's happening inside of our body through those gut microbes. And that means that we have to take a personalized approach and really do some self-assessment. And if you're struggling with your own self-assessment, maybe that's when you step in and you ask for the help of a psychologist or a dietitian, or maybe it begins with your primary care doctor, just having a chat about your overall health. And so our goals of talking on the podcast are going to be well-being and giving so many options for really optimizing health from this holistic perspective. But you are going to kind of speak to what really makes you happy and excited about a health journey. And I'm going to talk about what makes me excited and motivated to engage in a healthy lifestyle. And along the way, we're going to give lots of different opportunities, because each of us are individualized and each of our experience has to really be catered to.
Absolutely.
So with that kind of in mind, maybe we should pull back a little bit and share some personal information. So Kate, I know you have a personal experience in the GI world. So can you share a little bit more about that and how you came to be a GI dietitian?
Absolutely. So I was about 7 years into my career as a dietitian at the Brigham and Women's Hospital, and I was pregnant at the time. And just backtracking a little bit, I was a very generalist dietitian. I covered a lot of different clinics. I did a lot of oncology and cancer treatments. AIDS was really a big thing at the time when I started, and we didn't really have therapeutics. That was another area I was interested in. So I developed this colicky pain. I was 3 months pregnant. My belly just did not feel right. It was nothing that I had ever experienced before. So I went to my OBGYN and just said, I'm not feeling right. So they brought me into the hospital. And, quite honestly, it was a little traumatizing because they didn't really believe me, and thought I was a little pain seeking. And I'm like, I don't want medication. Actually, I'm pregnant. I want my baby to be healthy. And they kind of sat on me for about 24 hours just under observation. And I remember my OB/GYN came in and just looked at me and said, she does not look right. Take her to the OR right now. So they took me down with a presumption that I had an appendix, inflamed appendicitis, kind of thing. So just a spinal, here we go. And I just remember like the 5 minutes into the surgery, they said, we need to put you out. Then I woke up and realized that they had found that I had 8 feet of strangulated and small intestine. It was dying inside of me. So I lost about a third, a little more, all of my ileum, a little bit of my jejunum in the small intestine. And so the surgeon sent me home. My baby lived, thank God. It was very, very scary time. I was in the hospital for almost 2 weeks. And the surgeon just said, go eat a steak. Well, I didn't have an ileum. I wasn't tolerating fat. I was just a mess. And so it really catapulted me into wanting to learn about GI nutrition and what works because I was gassy. I was bloated. I felt so uncomfortable. I was growing this baby at the time. And I'm like, there's got to be a better way. And I'm grateful because I found the better way and I've been able to really utilize what I learned from myself for thousands and thousands of patients. And it's been just such an incredible journey and just such a rewarding career. It's been amazing. So having that experience was awful, but it made me a really empathetic, compassionate provider and just a thirst to learn more and more about this area personally, but also to help people. So that's a long story, but that's mine.
I mean, it brings up this reality that unforeseen, unpredictable, uncontrollable health issues, nobody is immune to them. Mm-mm. And pregnancy in itself is an anxious time, and every pregnancy is different. And I'm sure that this experience shaped and has probably impacted the way you communicate with patients and hear them and validate them because I know so many of the people that I've worked with have not been believed. And so if you can validate for somebody their experience and guide them to better health as a practitioner, that's beneficial, but that, single-handedly. So your story is really powerful.
Well, thank you. No, it's like I always say, when life gives you lemons, make lemonade. I know it's a little, cliche, but it definitely, is like a terrible situation that created a beautiful career and really a rewarding space for me, meeting beautiful people like you. Tell us a little bit about your story, Megan, because GI psychology is relatively new. And how did you land in this area?
Yeah, I was fortunate to go to graduate school in Chicago. And through my doctoral training as a clinical psychologist, I had these diverse learning experiences. I had the opportunity to work with people from a variety of diverse backgrounds. I got to see and treat many different psychiatric conditions. And I felt as I was graduating and kind of starting to think about where I wanted to head with my career, I had a strong hold and a good understanding of how to help people manage their mental health. But when you help people manage their mental health, you also are helping them with their physical health. And an opportunity at Northwestern presented to join a behavioral health fellowship that was really the only of its kind. And so I got training in gastroenterology with two of the leading experts, Dr. Lori Kiefer and Sarah Kinsinger. And I fell in love with being able to work with patients using evidence-based psychological therapies to improve their gastrointestinal health. And I treated a lot of upper GI conditions because at Northwestern, there's a lot of experts in the area of the esophagus. So treating patients where this was their fourth, fifth, sixth doctor's visit. And what really started to happen in a lot of instances were the esophageal MD specialists would see the patient, diagnose them or confirm their diagnosis, and then make a referral to our GI behavioral health program to really approach their issues from a multidisciplinary perspective. So teaching people the benefits of stress management on how their brain and gut communicate. And in a short period of time, when we think about psychology, sometimes people are in therapy for months and years at a time, and there's certainly room for that, and that can be important. But in our area of work, we do things pretty quickly. So anywhere from 5 to 7 sessions. And so being able to offer that and grow that program here, grow the program at the University of Michigan, I've just found such joy and such excitement for the field. And, again, getting the opportunity to kind of work with my dietitian colleagues, my gastroenterology colleagues. There's no I in team. That's really the important thing here.
Absolutely. Cannot agree more. It is amazing. When we think about GI conditions, particularly maybe because we're both enmeshed in this area, it's the multidisciplinary approach is just so therapeutic and shown to be more effective in treating patients. So it's nice that we're seeing both fields, GI dietitians and GI psychologists, growing in numbers throughout the U.S. and being available to help people. So I thought we would transition a little bit from ourselves and then into a little bit about the gut microbiome, because, we talk a lot about gut microbes and the microbiome, and just some clarification on some common terms and a little understanding, because I think when people think about gut microbiota, they're just thinking it's bacteria, but there's a lot of other microbes in there, from viruses to fungi or yeast, archaea, which is like it's one of the most ancient microbes, a little different from bacteria, protozoa. And these all play a role likely in our gut health, but we really haven't expanded much beyond. We're starting to tap into the role of viruses and fungi in the gut, but bacteria definitely much more tapped into and understanding that. So when we talk about gut microbiota, we're talking about the different types of microbes that reside there. And gut microbiome is a little bit different because they're talking really more specifically about not only the gut microbes, but also the genetic material they contain. So there's so many more microbes than just human cells. So there's so much more genetic material that is really impacting our overall health and well-being. They're a big player here because they might be small, but they have a lot of genetic material that contributes to our overall health. The other thing to really understand, and Megan kind of mentioned this, is that diet can affect who's there and what they're doing, but there's so many other factors that affect our gut health and what the gut microbes are doing and who's there, whether we were breastfed, whether we were born by cesarean section, whether we had a bunch of antibiotics as a kid like me, or...
And my kids, my gosh.
Right? Like there's sometimes we can't help the things that may alter the gut microbiome, but in various things, whether you have a pet or not, can favorably, which I'm getting a puppy, so I guess I'm going to get a better gut microbiome. But, lots of factors play a role here. It's not just diet. And I think sometimes people really hone into the diet, and diet's important. I'm a dietitian, but it's not the one all be all. There's lots of factors that can affect these microbes that live in our gut and what they're doing and how, really they overall affect our health.
I think that's fascinating. And it just reminds me every time one of my kids is given another round of antibiotics, the more I know about GI, I just start to go, oh gosh, like here we go again. But we do the best with what we can, right? Mm-hmm. So if I can avoid an antibiotic, then I try. But if we need one, then we have to do one. And, if you can try to breastfeed, great. If you can't, you know what? A fed baby is a happy baby. So I think it can be anxiety provoking when we think about, especially when we think about our kids, right? So we're trying to do the best we can for our kids. But what I'm also hearing is like a little dirt isn't going to hurt, right? So if the dog licks the face, sometimes that's, just increasing the potential of gut diversity. So, I think here we are. We're going to give you the facts, but we're also going to be real with you.
Absolutely. Absolutely.
All right, let's talk a little bit. We're in the world of GI, but we want we've made this clear that our gut health is important to everyone, regardless of whether you have a GI condition. However, a lot of people have GI conditions. And I'm going to give you some numbers, but these numbers are probably even bigger because so many people don't even go see a doctor to talk about their symptoms because maybe it's normalized in the family. Maybe we just don't talk about, how often we poop or we don't poop. So about 40% of the global population, and this was a big survey study that was very recently done, is impacted by a GI condition. And this might be IBS. This could be other, what we call disorders of gut-brain interaction. And about 10 to 15% of Americans are impacted by IBS. And I always like in a large room of people. So let's say you're a college student and there's 200 people in your classroom. If you look around, there's a whole handful of people that are probably anxious about possibly needing to go to the bathroom in their college room. And so this impacts a lot of people. And you might know IBS is a condition where you have these alterations in bowel habits, and then you also have frequent abdominal pain. Constipation impacts about 1 in 5 Americans, and 3 out of 5 have never discussed their symptoms with their healthcare provider. I've sat in rooms of gastroenterologists where they have highlighted that this stat is probably very much underreported because the gastroenterologist was saying, I have IBS and I've never received treatment for it. And so there's so much here that we stigmatize, we don't talk about it, we suffer in silence, we don't know that it's uncommon. And we are going to talk about these issues. In fact, we have a really great podcast coming up because Kate loves to talk about constipation and poop. And so we're going to give so many different hidden tricks and tips to keep you regular. And bloating, that's one other thing. I have to bring it up because how many times have women and also men, but you get home at the end of the day and you want to unbutton your pants, or you're wearing, the beauty of the Lululemon legging, right? We're all wearing leggings. They're more comfortable because probably we're putting tight pants on our bodies, and our bodies need that room to kind of pass gas and bloat a little bit. So we're going to talk about all these things. And really, I think now would be a great time for us to introduce some of our myth busting, myth crushing hot topics here. So let's jump into this, right?
I love it. Myth busting. Let's crush a myth.
Yeah. Yeah.
Okay. So everyone needs a probiotic. This is one of my favorite topics because I'm not anti-probiotics, but I think we really need to understand what they are and maybe are they one size fits all. So does everyone need a probiotic, Dr. Riehl?
No, they don't.
That's right. So let's back up. What are probiotics? So probiotics are live microorganisms. So keep in mind, they're alive, okay? And they're administered in a certain amount that we know offers health benefits. So that means they have to be studied so that we understand that certain microbe helps a certain condition. So if there's a microbe floating in the sky and you're making sourdough bread and that microbe lands and contributes to some of the fermentation in that bread, that's great. Fermented bread's good, but that microbe's uncharacterized. We don't know anything about it. It doesn't classify, for instance, as a probiotic. So there's a couple things that we know. We know that some probiotics are beneficial. There's some probiotics that have been studied for irritable bowel syndrome that have good evidence to show some benefit in certain patients. But it's important to know that probiotics, as a general rule, are not regulated. No one's really checking to see if they have the amount of live microbes they say that are in them, unless they've been third-party tested randomly, but that's not normally done. And while they do appear to be fairly safe based on the scientific data, there's certain patients and individuals where they actually can increase mortality or lead to negative effects. And particularly immunocompromised elderly or premature infants, for instance, may be higher risk for using a probiotic. So if you choose a probiotic, you want to always start with asking your healthcare provider, is it appropriate for you and which probiotic would they recommend? When we're usually recommending a probiotic in my practice, I'm trying to correct a situation. So patients experiencing bloating or constipation or has IBS, I'm selecting a probiotic with scientific evidence proven for that particular condition. It's also important if you have a provider to ask for data. You're recommending this probiotic. I can buy it in your office. Do you have a scientific study on that? So some people are out there, they're making money on you buying their supplements, and you just want to make sure that they have science to suggest that this product is appropriate for you.
And the most expensive probiotics out there, are they the best?
Absolutely not.
There we go. One other thing, when you have a probiotic that sits right up next to the desk at the pharmacy, should we be doing probiotics while we're taking antibiotics?
Oh, good question. Should we?
I don't think so.
I don't think so either. Now, there is some data with some probiotics showing benefit to antibiotic-induced diarrhea. So there is some data that's, out there that might help with diarrhea, but there's also information looking at probiotics post-antibiotics showing that the microbiome took longer to sort of reassemble itself after the antibiotic when an individual was taking a probiotic. And we want our gut microbiome to bounce back to its normal status after an antibiotic quickly. So if something's impacting that, that's never going to be the goal.
Yeah. So it's important to talk with your provider about what they think and what's probably going to be best for you.
Absolutely. Navigating the gluten-free world can be challenging. You want something that tastes delicious without sacrificing quality. Introducing Char Gluten-Free, where flavor meets a world without limits. With a commitment to providing high-quality and delicious options for individuals with special nutritional needs, Char has become a trusted name in the gluten-free market all over the world. And many of their products are now certified low FODMAP by Monash University. From artisan breads to soft-baked cookies, from table crackers to pasta, Char has you covered. Rediscover a world of culinary possibilities. Available now at most major grocery stores or their online shop. Char Gluten-Free, made with the best of us.
This podcast is brought to you by QOL Medical, the manufacturer of Sucrate, saccharisidase oral solution. Sucrate is the only FDA-approved enzyme replacement therapy for the treatment of CSID. Patients who have CSID cannot tolerate sugar, sucrose, which can lead to unresolved IBS-like symptoms. After you've ruled out lactose and celiac, consider CSID. Sucrate is an enzyme replacement therapy for the treatment of genetically determined sucrase deficiency, which is part of congenital sucrase isomaltase deficiency, CSID. Sucrate may cause a serious allergic reaction. If you notice any swelling or have difficulty breathing, get emergency help right away. Tell your doctor if you're allergic to, have ever had a reaction to, or have ever had difficulty taking yeast products, papain, or glycerol. For more information and to see FDA-approved labeling, go to sucrate.com.
So I think in the next, 15 minutes or so, we'll see how this all goes. Why don't we segue into some key topics? So as a GI dietitian, I want to just bump into nutrition and your gut microbes. Diet does matter here. And again, I don't want it to be a one-all be-all, put all this pressure on you to have the perfect gut microbiome, healthy diet. That's going to add stress, and we know stress alters the microbiome. So we don't want a diet to be stressful. But we do know that eating more plants or more fiber-rich foods that are rich in polyphenols, which are plant chemicals that have antioxidant benefits. So an example would be a flavonoid, like olive oil. Extra virgin olive oil has a lot of those flavonoids in them, and those extra flavonoids are health promoting. They have this antioxidant effect, which basically means that they can help your body fight things that are going to drive inflammation, for example. So plants, fiber-rich foods that have these polyphenols, which we often see in really brightly colored fruits, vegetables, those really dark olive oils, also chocolate, just Throwing it out there.
I know. I'm like, I love a good olive oil, and I didn't know about the chocolate. So that makes me feel good too.
Okay, there we go, right? I wanted to talk a little bit about science because we are science here. This isn't going to be just, smush. We're just throwing out stuff at you like we know what we're talking about. So a couple studies I want to talk about briefly. So as a study, it was really got a lot of media attention, and it was primarily out of Stanford University. And they were looking at healthy individuals. So these individuals didn't have IBS or health conditions related to their gut, just FYI. They were healthy, and there was about only 36, so it was a small study, but they split them up. They put one half of the group on a high fiber diet, 40 grams of fiber per day. The average American, by the way, has about 15 to 18 grams, so we're talking lots of fiber.
Yeah.
And the other half of the group got fermented foods. What they had that group do is 6 servings a day of fermented foods. Again, a lot, not normal what we do.
A lot. Yeah. A lot of kimchi.
A lot of kimchi and a lot of kombucha. So anyway, when they looked at the microbiome and different factors within the gut microbiome, similar population, but different diet, they found that the fermented group did have greater microbial diversity in their gut microbiome. And when we have more diversity, that tends to be associated with a healthier gut. So that was interesting. They also found that some of these like inflammatory proteins that can kind of float around in our bloodstream were reduced, particularly one, this is again is in the fermented food group, interleukin-6, which is a particular protein that's associated with rheumatoid arthritis, type 2 diabetes. And so reducing this seems like a favorable effect. The other thing that's important in this group, when they used fermented foods, these weren't just anything fermented. Like sourdough bread is a fermented food, but then you cook it and there's no live microbes in there. This benefits to sourdough bread. Absolutely. But they were sticking with fermented food that had live and active cultures. So, if you get yogurt and it says live and active cultures, or if you got sauerkraut, for instance, and you got one pasteurized and one was unpasteurized, the unheated, in other words, didn't kill off the microbes, would have those live and active cultures. So that was really interesting. And then briefly, I wanted to talk about another study. This is out of the American Gut Project. This is a research initiative to really better understand the human microbiome. And it's sort of citizen crowdfunded. So anyone out there can send in their poop and fill out a lifestyle and diet history.
Okay, I've got some people that would love to do that. For all those people that are really paying attention to their poop, think about this project.
Exactly. The American Gut Project. Write it down. So what they found here when they looked at the data is that in individuals that ate 30 different types of plants per week versus those that only had 10 different types of plants, so plant variety here is really important. They had a greater gut bacterial diversity, and then they had less genes that helped bacteria avoid antibiotics, so less antibiotic resistant genes, which is good for what they call antibiotic resistance. So the individual would have more likely to benefit from antibiotics. They didn't resist certain ones. So again, just showing diet effects on the microbiome. Plant variety seems to have a more favorable effect. So let's drill this down to an everyday tip. Eat more plants, eat a lot of diversity of plants, and include fermented foods, particularly those with live and active cultures. This tends to be associated with a more diverse group of microbes in your gut, which is associated with better gut health.
I'm not a dietitian, but I work with them. I try to, when I'm putting together a meal, think about eating the rainbow. Right. So even with my kids, I'll point out like what colors are on our plate, knowing that those different colors all signal different kind of key benefits for our gut. So, I think that that's a simple takeaway of just variety, color, and knowing that it's good for your gut and promoting gut health.
Totally. And I agree with you. And I think we're creatures of habit. So like, even if you have variety, but if you're buying the same vegetables every single week and you go and just get your blueberries and strawberries and hit out the store, think about trying something you've never had, or, zip in and get a mixture of vegetables that you can, add a little variety to your stir fry. So I think, again, just getting the color of the rainbow, but also like breaking outside of the box a little bit and trying something new.
Okay, I'm adding that to my to-do list here. All right, so new topic, but also related, right? I want to highlight a little bit about stress in the gut, a little bit more. So we've talked about how stress can impact our gut microbiota, and that happens by how neurotransmitters and the chemicals that are being produced within our brain and our body interact. And also recognizing, I think a lot of times people, again, think stress as emotional. And really, stress impacts us emotionally, but also physically. We have physical signs of stress. That could be feeling butterflies in your stomach before something that you're excited about or something that you're nervous about. That's a signal of how your brain and your gut are functioning. And it's also a signal that different chemicals are being produced in your body, and even some of our serotonin. The majority of our serotonin is actually produced in our gut. So we know that stress exposure, and none of us are, again, immune to it. We have to think about it when it comes to our overall health and how do we manage our stress. And I'm going to provide a lot of everyday tips on stress management, but I'm going to start today with something that we can all do. And that's thinking first, how am I doing with my stress management? Do you feel overly stressed? Do you feel like you're managing your stress well? Do you even acknowledge and understand whether you're impacted by stress? So start with that simple question. I really think we could all reflect on that. And for those of us that can acknowledge we can probably do better at stress management, routine. So let's start with routine. Is there something that you're doing regularly that is of benefit to reducing your levels of stress? And this might be regular implementation of a deep diaphragmatic breath. So we know that when we take deeper, fuller breaths from the belly, that's a different breath from the normal breathing that we're doing from our chest. And that diaphragmatic breath is not only beneficial from an emotional perspective. So a lot of people think about deep breaths as helpful for calming down and for relaxation, but it can also relax our body physiologically. So helping to reduce muscle tension and even digestive distress. So if you don't do diaphragmatic breaths or just deep, calming breaths a couple times throughout your day, I'd challenge you to begin to think about how you can incorporate that and maybe anchor it to something that you already do. So brushing your teeth, eating breakfast, brushing your teeth at the end of the day, taking a shower. So when you do those things that you already do, you might add in 60 seconds of just slowing your breath down, getting present in the moment, starting to shift from maybe a busy day to winding down. Also, we can implement other aspects of self-care, and exercise are so important to our overall stress management. And again, the routine of that. So, if you're only exercising, maybe you're not exercising or you're doing it once a week, challenge yourself. Schedule it like you would any other appointment. I point this out to my patients when, somebody is just starting to get into exercise. And I'll say, look, you showed up 5 minutes early for our appointment today. So you got yourself to someplace that meant something to you. And we need to treat ourselves the exact same way. So schedule your self-care, your relaxation, your time for exercise in the same way that you would schedule any other appointment with somebody else. You deserve it.
So I just want to say one thing about the diaphragmatic breathing, because I love this technique. It does engage that parasympathetic nervous system, so that sort of rest and digest. So do you think it's a good thing for individuals to try to do that before a meal?
It can. I've made the recommendation before or after a meal. So if you're somebody that is rushing so much to like get in your lunch and get in your dinner and you're not stopping to kind of pause, then I think maybe it's a good idea to just before you take that first bite, take a couple deep breaths. Chill, go into your meal with a little bit of relaxation. But also, if you're somebody that maybe does struggle with some digestive symptoms, or you're going to transition into maybe exercise after a meal or going for a walk, I think that diaphragmatic breath afterwards for, even just 5 diaphragmatic breaths is going to help a lot. I think that that's a nice way to kind of wrap up a meal.
Okay. I love that. I love that idea. So last kind of tip for today is just that gut health is personal to you. And Dr. Riehl mentioned this, that you have your own gut microbial fingerprint. So diet will be not one size fits all either, because you've got your own microbes, and some of the microbes in your gut can digest fibers that maybe your neighbor's gut can't digest, or you both can digest the same fibers, but your gut produces butyrate, which is a short chain fatty acid that's a fuel for the gut. And then they don't make that. They can digest that, but they don't produce butyrate. It's complicated.
Mm-hmm.
So, just a reminder that same with certain therapeutic diets. They're going to benefit, like the low FODMAP diet, which we'll get in on a further episode, which is a diet that's out there for irritable bowel syndrome. It's not going to work for everyone. In fact, it only works in about 50 to 75% of people. So there's up to 50% that will just not benefit from that diet. So I think from an everyday tip, from the fact that gut microbes are really personal, it's important to really listen and tune into your body's messages. And when I say that, I'm not encouraging hypervigilance and like, I feel a gas bubble. It doesn't hurt, but I could feel it. Not that kind of thing. But if you're feeling continued, repeated pain every time you take the probiotic supplement, maybe ditch the probiotic supplement. It might not be for you. Maybe it works for your neighbor. They have a different gut microbiome. So just remember that diet and lifestyle to really manage your gut microbiome is going to be personal, and just listen to the messages gently to your body to do what feels right on the inside for you.
And don't go at it alone. Right? So
yes,
if you feel like, you could use a little guidance, talk with your medical providers and we'll give some resources in terms of how to find people like us, dietitians and psychologists, mental health providers. But a team approach is oftentimes really helpful. And again, we can personalize strategies that make sense for you.
Love that. So I wanted to, as part of our podcast, we wanted to do just like status update, right? So why don't we start with you, Megan? What's going on in your life, and why don't you share it with our audience?
All right. So I'm a working mom, right? I've got 3 little kids, 7, 4, and 2. I'm a little bit myself a germaphobe, right? Like I'm not phobic, but I like to keep things clean. Before the pandemic, I was somebody that was scrubbing the airplane seat before I sat down. Okay. So we recently traveled. I had to completely let go of my germophobia as my 3 kids were basically licking every surface in the airport. And then, every space that we went from there on forward. So I let go of control there. We were having fun. I think that life is just busy right now. I'm going to be traveling next week solo. So it's going to be a little different,
yes,
a little less germy, I think. But as a psychologist, and, I always have my anxiety management hat on, my kiddos are starting to recognize when I leave. And that's, a little bit tough on the mama heart.
Mm-hmm.
So one of the things I'm working on is kind of talking ahead of time, because when kids get anxious, they're prone to tummy aches. My head hurts, my tummy hurts. So we're starting to just talk openly, communication with my partner, doing the same thing, talking about what's coming up for mom with travel, when I'm going to leave, when I'm going to come back, what I'm going to be doing, giving them details because they're curious, and, doing it in an age appropriate appropriate way. And I think that that's going to help with this trip because my 7-year-old has been asking now for the last 2 weeks, like, when are you going? How long are you going to be there? So we're talking about it. And I can feel, his little anxiety is getting a little bit better. And then to manage my own anxiety, you're going to hear me talk about Peloton. Self-care for myself is something that I try to prioritize, and I do it on that bike. Prior to the pandemic, I would have said I was never going to own a Peloton, but here I am. And so for all the working parents out there, especially with littles, come with me on this journey of relinquishing the guilt of hopping on a bike or a yoga mat or heading outside for a walk. Give yourself, you probably don't have a full hour most of the time. I aim for 20 minutes. And that might mean bedtime gets pushed a little bit. It might mean that I'm exercising and I know the kitchen is a disaster. But I have really, over the last several years, carved this time out. And I think it's so important. And I need it for my own wellness.
Yes.
So Alex Toussaint is my guy. He's my coach. I am big fan over here. But that music just pumps me up. I'm motivated by him, and I don't have to be the therapist.
I love that. I love Alex too. And I have a Peloton, and I never thought I would have a Peloton either. But I'm definitely an outside person. Like, being in a forest or walking outside is totally my jam. That is where I feel totally at peace. And so I try to get outside and do the walking. It's getting a little harder. It's colder here. Kids are grown, so I don't have that sort of stressor. But I definitely, writing a book, starting a podcast, getting a new puppy, I've got some, little bit of anxiety creeping in. And I have to say that learning from you a lot, Megan, has really helped with, helping manage some of my anxieties. And any just quick tip for outside of diaphragmatic breathing, other ways to just sort of decrease the anxieties of life?
Yeah. So a daily check-in of just how am I doing today? And what do I need? Because I think you've been preparing for your puppy and how that's going to change your life a little bit. You and your husband, you get to jet set, you talk around the world. And so some of that's going to change a little bit. You're going to have a baby in the house again.
I know.
And it's really easy to get way up into the future thinking about things that are out of our control, and you won't know what it's like until you get up there. And so if you can kind of dial back and say, you know what, today I need self-care, or today I need to, only address the must-dos on the to-do list. Or you might find that your answer is, dang, I am feeling great today. I'm going to bust through a bunch of to-dos. So I think that when we're able to scale it back and not get so caught up in the future, that can be really helpful for our anxiety management and even just daily stress.
Absolutely. Which all dials it back to stressors, gut health. It all is, a big, big fat web, right?
Yep.
So should we talk about what's coming up, or, what do you think?
Well, okay. I could use some help, and I'm going to ask and use you as my accountability person. I admit, sometimes my nutrition is not the greatest. And the psychologist in me says, it can't be perfect. You don't have to be perfect. But I think sometimes if I have a challenge, the stick-to-itness of me will go for that. So as a busy working mom, what tip can you give me so that I can feel like I am really boosting my nutrition this month? And I'm going to do it.
Okay.
So give me one, and I'm going to feel good about my nutrition when we record again.
I love it. Okay. So when I talk about nutrition, I really feel like it's important to think about what we can add, not focus on everything we can take out of the diet, because I think a lot of people focus on avoid this, avoid this, avoid this. One of the things that I feel most of us are really falling short on, and the data shows it, is vegetables. There was a survey study looking at Americans' intake, and it was 10% of Americans are eating the amount of vegetables they should. 10%.
Okay.
So the goal veggie intake for adult women like you, Megan, is 2 to 3 cups a day. if you had a large salad, you could be hitting that easily. But, sometimes people are grabbing a bagel for breakfast and then, who knows? They're eating some tortilla chips in the car.
Chips and guac.
And who knows, right? So a couple goals, and I think this might be fun for the kids, is try to look at the grocery store, look at pictures online, pick out one vegetable that you've never tried, do it together, and just try the vegetable. So that's just one thing I want you to work on. Once a week, pick out a new vegetable.
All right.
The other piece of this is I want you to think about at least at 2 meals a day, have 2 different vegetables. So at breakfast, that could be that you're adding spinach and mushrooms to an omelet, or you're adding spinach and carrots to one of your, veggie fruit smoothies in the morning. Or you roast a huge pan of different types of roasted vegetables and you throw that on top of your rice or throw that in a stir fry or have that around. But I want to make sure that you have 2 different vegetables at least 2 different meals a day. So you're having, ultimately you're meeting that 2 to 3 cup need, but you're also getting some variety of different ones. How's that sound?
So that's a challenge, but I think that we are up to it. And by we, I mean, don't make me do this alone, listeners. Come on. I know I'm not the only one. So yeah, I will report back.
I love it. I love it. Outside of the diaphragmatic breathing, any other tips for me for my little bit of anxiety with being a dog mom?
Yeah, get outside. I know you like it already, but, bundle up if it's cold. Don't stay inside. Although I think you're pretty good at this, but you'll just have me in your background, just kind of reminding you. We live in the Midwest, or I live in the Midwest. And so when it gets cold, we tend to not get outside as much. And I think if you have the essentials, so you've got a warm hat, you've got the gloves, you've got the boots, don't be afraid to get outside if it's cold, because that fresh air is so good for our brain and our body, our mood. And so I'd say, if you're feeling anxious, go for a walk, change the environment, get outside, just even if it's a brief walk, give that a try.
Okay. I love that. So I love that. And I'm going to do that. And I'm going to think of you. I'll hear you in the back of my head. So what should we expect on our next episode?
We have a very exciting and dynamic guest, Dr. Jamie Kanukin. She is a gastroenterologist at the Mayo Clinic in Jacksonville, Florida. And we are going to be talking all things poop. What's normal?
I love it.
It's going to be good. All those burning questions that we're all too embarrassed or we don't have the opportunity to ask or we don't know where to ask, we're going to be able to ask Dr. Kanukin. So we are going to be in for a very informational treat, and we're all going to walk away learning a lot about our poop.
So exciting. One of my favorite topics. So we'll see you then.
Thank you for tuning in. If you are enjoying what you're hearing, give us a subscribe, a like, a follow. It means a lot to us, and we really want to build this community. So right now, stop, do it for us. That way you won't miss an episode. And join us for the poop episode. You won't want to miss it. Thank you for joining us as we grow this gut health community. We hope you enjoyed this episode, and don't forget to subscribe, rate, and leave us a comment. You can also follow us on social media at The Gut Health Podcast, where we'd love for you to share your thoughts, questions, and experiences. Thanks for tuning in, friends. Thank you for joining us as we grow this gut health community. We hope you enjoyed this episode, and don't forget to subscribe, rate, and leave us a comment. You can follow us on social media at The Gut Health Podcast, where we'd love for you to share your thoughts, questions, and experiences. Thanks for tuning in, friends.